and welcome to World Insight from Beijing. I'm Tian Wei. Are the clusters of outbreaks in Beijing being contained? The recent outbreak of COVID-19 in Beijing has sent jitters to the public. The city has raised a level 2 emergency response. That means tighter mobility controls have been reinstated in all communities across the city, and schools are closed from Wednesday. But Beijing did take measures to ensure the stable supply of essential goods. So what's the prognosis for the city's new infection clusters? The likely source of the new wave of cases? Has the recent outbreaks been contained? We got the direct answer from Professor Wu Zunyou, the chief epidemiologist of the Chinese Center for Disease Control and Prevention. And here is the science behind the latest outbreak in Beijing when I was talking to him earlier today. 31, 21, those are the confirmed cases over the past 3 days. What is this telling us?
So what you just said is based on the date of diagnosis. This one is based on onset of illness. It gives you more precise understanding of true epidemic.
Ah, so this is the June the 13th. This is the most impressive we have here, number.
Right. I think that the epidemic peaked here is most of people had symptoms here, the first time have symptoms. That means they have a common exposed to one single source.
I see. The blue part is the confirmed cases, and also this yellow part is more about positive testing.
That's correct. They have a certain proportion of cases are tested positive. That means they actively screening identify cases in the early stage.
And when we look at the trend, it seems quite clear.
So that indicates the epidemic contained.
Good news. If you look at Beijing, the history of, there we go, yeah.
Right, I think look at overall epidemic curve. So the first in the January and February, the epidemic peaked in the February, then going down, almost stopped completely transmission. So we have about almost 2 months, no single case reported. Even now, the epidemic, a small jump here is not as significant. So the epidemic, now it's in the Beijing, they have successfully controlled now.
I see. What about the overall in the country?
Look at the big picture of epidemic in the China. So the epidemic peaked in the February. We have one single day, big jump. That yes. Because they have accumulated large number of cases, cannot be diagnosed based on laboratory. It's a big based on clinical diagnosis. They have big jump. So that solves the previous accumulated cases.
That's February the 12th.
Right.
And then we have almost the flatten out. And here is really small number right. until today.
That's correct. So look at the number of cases. So based on the early February, China almost stopped domestic transmission. We have sporadic cases imported, does not generate the big epidemic. It's only sporadic cases with very small cluster. Even in the Beijing, look at China overall, that small number does not create the national spreading. So it's a very good news now.
Professor Wu Zunyou, Chief Epidemiologist from China CDC. What a pleasure seeing you, sir.
Nice to meet you.
So you said 4 days ago that the numbers coming out over the next 3 days are going to be essential. So let's look at the numbers. 31, 21. What does it say about this outbreak here in Beijing?
The outbreak already contained. The number indicates most likely they are previously infected, not newly infected. So most of the cases actually infected before June 12th. They identified in the past 3 days.
Interesting when you say happened before June the 12th. With what kind of scientific evidence would you be able to make that judgment?
So the first, I think the most important is the Xinfadi market was closed, and alert immediately sent out, and they quickly identify people already infected. That stopped secondary transmission. So most of the people newly identified in the past 3 days, they are most likely infected before the market was closed.
But what would you led you to reach that conclusion? I mean, can you tell from the symptom that they were infected days ago? Can you tell from the strain of virus that you found in these patients that they were infected days ago? How should we know that it is now the second round and the third round as a result of the earlier first round related to Xinfadi?
I think it's based on basic epidemiological understanding, the transmission dynamic.
Tell me more about that.
Okay, so if the epidemic continue to spread, then the number will continue to increase. And also the number they need generation. Each of generation interval, it's about average of incubation period, 3 to 5 days. So the number does not continue to increase. That suggests the number, it's the one common exposure. They do not have secondary or the tertiary transmission. So that give us confidence the epidemic is contained now.
Are you worried that there will be future cases? As you said, that there might be 3 to 5 days, and as we know, in certain cases, the days could be even more than 3 to 5. So are you worried about there could be a possibility of the second round, or not at all?
I did not think that way, because with not just based on the epidemiological data, we also look at the big environment, particularly the response. So response in the Beijing city is vigorous and timely. So the quickly isolation or identification of cases, and identify close contact, all these measures are very powerful and effective. So combine all of this together, we could make that assessment.
Are we going to see more clusters and communities likely to be alerted? Because now we see the list in Beijing is getting ever longer. It is spreading to almost all of the districts and counties here in Beijing. So in the next few days, are we going to see that further being enlarged, that list, despite the fact that you said it's already being contained?
So the number of districts will maybe a little bit more to increase, will be not large. So my understanding, the epidemic now is contained. The number of cases identified will not be increased in the next few days.
What's it like for you? I mean, Professor Wu, you were there day one for this outbreak, cluster of outbreak in Beijing. I could tell from the way your facial expression was. You were extremely worried together with many other experts. Now, as you said, it's been contained. But how would you reflect back about the past few days? You know, finally, but still, just a few days' time, it's like a roller coaster almost.
Beijing already had almost 60 days, no newly reported cases. Suddenly comes with such a number of cases. That's surprised us. And we are also very lucky, Beijing, they responded very, very quickly. When the first cases are diagnosed and reported, they immediately and identified Xinfadi market as a potential source for the outbreak. Then they quickly do the screening and identify more cases, then take action to close the market and alert the community. That response is very, very effective to control the epidemic. If they take a few days later, the outbreak will be much unexpected. It's out of control.
Some were even suggesting that if things continue as it is, without immediate actions against the spreading of the virus, within a week or 10 days, Beijing could be another Wuhan.
That's possible.
That is possible.
Yes.
Professor Wu, Beijing is already the center of China. More protective measures have been taken in this place than any other place around this country, I would say.
Mm-hmm.
So if Beijing this time be able to contain it, does it mean the rest of the country will be able to do that if similar things happened?
I believe it is true, particularly if we look back. So in the earlier this year, then the outbreak took place in Wuhan. So the cases migrate or move from Hubei to their hometown. So look at other city provinces, excluding Hubei. No single province had a total case over 2,000. So that means after cases move to other provinces, then they take an effective response to contain the epidemic. So based on that experience, if any newly sporadic cases occurred in each of city or provinces, they are ready to contain.
What do we know now, Professor Wu, of this virus? We know it might be coming from a strain so-called originally from Europe. Mm-hmm. We also know that this time it is different from the one that we discovered in Wuhan. Mm-hmm. We also know it spreads fast, but for now, not many are severely ill, mainly minor symptoms. Are these fundamental characteristics of the strain of virus we have discovered in Xinfadi, or are there other important characteristics of this strain of virus, Professor?
That's very interesting and very important. So when the epidemic takes place, we also ask a question ourselves, how the virus brought to Xinfadi? It's another spillover. So we look at the virus strain and compare that with the already identified. The virus sequence clearly indicate is different from previous spread in the Wuhan, in Beijing. It indicates the virus is coming from a European circulate. It could be coming directly from other countries. It may also come from domestic other places that with imported cases. So it clearly is not another spillover. It is coming from outside of Beijing.
Are you trying to blame the European countries?
No. No, I'm just saying the virus does not have a broad, and the circulate is coming in the different countries. Even in the China, in the later April or in the May, the major circulate is the European strain. It's not the strain occurred in the early in the January or February in China.
And you're also trying to say it is not a new animal jump.
Yes. No.
That's very
not
important.
Yes. So it clearly is already circulated in the world, in the many different parts of the global.
Yeah.
So it's not jumping from animal species to human. No.
You are personally involved in this research-related investigation team established by the China CDC and China Health Commission with the Beijing municipal government. Tell me about the direction of your research. What are some of the most important hypotheses you're all looking at the same time?
So now we have a joint team. So we have two different categories. One is a public health response team. That is make the epidemiological investigation, try to identify close contactor, then to have them quarantined, making sure the epidemic contained. We have another team, scientific research. Scientific research try to address scientific questions. So we have two hypotheses for this. Two scientific questions. First question, how the virus brought to the Xinfadi market? It could be by contaminated products imported, could be by human. That could be employee or vendor working in the seafood market. They may, like after reopen, they coming from the epidemic area, coming back to Beijing, brought the virus to the market.
Customers.
Yes, or customers. So there are three directions we are under investigation, try to create a linkage, the possible source brought virus to Xinfadi market. The second scientific question, how could seafood market, that seafood vendor area, become epidemic center or become possible source to spread a virus? How that be formed? How could that be created, given that small environment we try to understand?
If we look at the sheer number, 31, 21, altogether, yes, more than 100, but if you look at, just one of those states in the United States, Arizona, for example, every day more than 1,000 confirmed cases already lining up. Why people, though, are paying so much attention to what is happening now in Beijing, which is a cluster of outbreak? Why is this study so significant?
I think it's very important. People worry about is this second wave, a big epidemic. That's one people interested. The second, can Beijing contain the epidemic? So that are two questions people are curious. And I think, again, the action Beijing City take, it has approved the epidemic could be controlled in the Beijing, in China. I think most important in Beijing's case, they take action earlier, does not allow the virus spread in the community. So if you look at early cases, over 80% pointed to one single source. That means the virus is only occurred around that area. People working there, people visit there. So if we look at the data, so previous epidemic, or in the past few months, the epidemic have two clusters. One is a family cluster, another is a hospital-based or clinical-based cluster. So look at the Beijing case. We did not observe major family cluster or hospital setting cluster, and no community cases. That means we identify epidemic in the very early stage, and we respond timely and promptly and effectively.
So what Beijing is experiencing right now be a case study for all the other countries and all the other economies who managed to partially survive the first stage?
It could be possible. So in the future, it's very hard to predict, and we will expect sporadic cases could be occurred in any of city or places in the future.
We see already outbreaks in Beijing, the capital of China, Seoul, the capital of South Korea, Tokyo earlier, the capital of Japan. Northeast Asia being considered as having early success for dealing with the first round of COVID-19, but now all suffering from clusters of outbreaks in megacities. Now, some say this is really a dangerous trend. Your take?
I think the most important for the respiratory disease, it's related to the population density. So the crowded area, they're more likely to have the outbreak for the respiratory diseases, and also the frequency of movement of people. So no movement, no spread, no outbreak. When you have faster movement, then the virus could spread very fast. So the big city, megacity, will be hot places for epidemic like COVID-19.
So this is
right.
Literally. Thank you, Professor Wu Zunyou, for sharing your insights and also your knowledge with us.
Thank you.